All right, joining us now, former U.S. Surgeon General Dr. Vivek Murthy. He's the author of the new book entitled Together, The Healing Power of Human Connection in a Sometimes Lonely World. As if you predicted exactly what the title of this book should be a year ago or whenever you came up with it. Now, it's incredible, the timing. I want to ask you about the book, but first I want to ask you, as former U.S. Surgeon General, these social distancing guidelines that we are right now enduring, executing here in the United States, do you see these going away anytime soon? I'm talking about wearing masks, handshakes, businesses that require physical touching, gyms, salons, spas. Do you see that getting back to normal anytime soon? And I mean soon as in months.
Well, thanks, Mika. It's good to be on with you. These social distancing measures that you've mentioned, these have really transformed society, and people are making extraordinary sacrifices right now to make sure that they're following these rules. I think that we will see a time where we can relax these rules to some extent, but they're not going to go away until we have something transformative like a vaccine that can really take the threat of the virus off the table.
So sacrifices, or perhaps they could be seen as behavioral changes, because even when a virus is a vaccine is potentially 18 months away, maybe sooner, maybe later. But in terms of society, won't these behaviors continue?
Yeah, so right now, many states are still under stay-at-home rules, and we will start to see those relax as cases come down and as we build the infrastructure that's critical to ensure that we can test, trace, and respond in terms of treatment capacity. But we'll still have some degree of distancing requirements that remain. For example, we will likely still need to wear masks in public for months and months. We will still likely need to keep distance from each other to ensure that we are observing good hand washing practices to avoid touching our face when we're in public and to avoid large crowds and gatherings. One of the things that we've learned, Mika, is that COVID-19 is in some ways, it's a different beast than what we've experienced with past viruses, and we're learning new things about it every day. That's why it's so important that we err on the side of caution, because the more cautious we are, the more lives we can save. That doesn't mean we can't start to get back to our way of life over the next several months, but we've got to do it safely.
Yeah, Willie.
Doctor, it's Willie Geist. Great to have you on this morning. The subtitle of your book, Together, is The Healing Power of Human Connection in a Sometimes Lonely World. Obviously, we can't have that physical connection right now. We can't have that physical gathering that we're used to. A lot of people worry about the long-term impact on the elderly, loneliness, on young children who can't run around with their friends. We're all seeing that in our own lives as this goes on. And you write about something called a social recession. What is that exactly, and what are your concerns in the context of this crisis?
Yeah, Willie, if you had told me a year ago when I was in the throes of writing that we would be in the midst of this massive physical distancing scenario, I wouldn't have never believed you. But here we are. And like so many people, my own family has going through transformation as well. I have two small kids, 3 and 2, who can go on play dates and who are wondering why they're confined to the house. I have elderly parents and a grandmother as well who I'm worried about. A sister who's seeing patients as a doctor. I'm concerned about her risk. Many of us are trying to figure out how to make this all work. But what I worry about is that, well, we were talking a lot about the physical impact, physical health impact of COVID-19 and about the economic impact, both of which are substantial and important. I worry that we are not recognizing as much the impact on our social health. And I worry that as we spend more and more time apart from each other in a climate of fear, that will deepen our loneliness, the loneliness we've been experiencing in many cases for years and years, and contribute to a social recession. What I learned, Willie, when I was Surgeon General, is that loneliness was far more common and consequential for our health than I thought. I met people all across America who told me stories about their struggles with opioid addiction, with chronic illnesses like obesity, and also with depression and anxiety. But behind so many of those stories were threads of loneliness where people would say, I feel like if I disappear tomorrow, nobody would realize it. I feel that I have to carry the weight of all of these burdens on my own. I feel invisible. And as I dug into the research, I realized that about 22% of adults in America, according to a 2018 Kaiser study, admit to struggling with loneliness. And people who are lonely seem to have a higher risk of heart disease, dementia, depression, anxiety, as well as sleep disturbances and premature death. So loneliness matters. It's common. I'm worried it could increase, but I don't think it has to be this way. I think this can be, in fact, an opportunity to turn the tide on loneliness and build a social revival in our country.
Former U.S. Surgeon General Dr. Vivek Murthy, thank you. The new book is Together, The Healing Power of Human Connection in a Sometimes Lonely World. And coming up, the mayor of D.C. taps several high-profile figures to help respond to the coronavirus pandemic. Mayor Muriel Bowser joins us to discuss that and the bipartisan team she's putting together to help decide when it is safe to reopen.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.